the best. We have Dr. Kevin Freedman. Dr. Freedman, how are you?
Hey, Ann, how are you? I'm doing well, thanks.
Great to have you back, buddy. You excited for the Eagles?
Yeah, very excited. Training camp started. We're ready to go.
It's nothing better. It's a football Friday. I got you with me, man. What do you think, man? What has you most excited about this team?
Well, I'll tell you, first of all, when you see those rings, you get pretty excited. It looks it's pretty nice celebrating last year. I wish I could have one, but look, it's an exciting new season. Hopefully, our defense is still going to be able to, do what they did last year, and certainly we're going to have a great offense again.
Yeah, I mean, and the young D, like watching Cooper, Quinion. I mean, this is like an embarrassment of riches in this town. You're a Penn guy. You're a Philadelphia guy through and through. You've lived this.
Yeah, absolutely. It's an exciting time. We're gonna have a good run.
I love it. All right, let's talk about Nakobe Dean, and let's talk about his injury, which is the Patellar Tendon injury. Doc, can you explain just the importance of the Patellar Tendon in the knee and what that's about?
Yeah, absolutely. So the patellar tendon is the connection between, you have your quadriceps muscle, the big muscle in the front of the knee, you've got your patella, and that tendon connects the kneecap, the patella, to the shin bone. So it really provides that force for extension. And when it's ruptured, basically you can't extend your knee at all. So it's a pretty serious knee injury.
How prevalent is it in football players?
Well, it's interesting. We see it, but it's nowhere near as common as some of the other knee injuries we see. Like we hear about ACL tears, the ligament in the center of the knee kind of all the time. So even though we see it, and there's always a few of them a year during the football season throughout the whole NFL, it's just not as common of an injury. And they've done some research on it and shown that it is way less common. We see it a little more common in basketball players and some other jumping sports than we do in football.
So when you get that repaired, how worried are you about kind of re-injuring that thing? When it comes to the stability of it repaired. As a torn Achilles tendon guy, I know it's got fortified by my cadaver tendon that you guys put in my ankle, and it's the best. How much concerned are you with the patella re-injuring it?
Well, so the recovery is tough because it's a little harder to regain your motion initially and then eventually to get your strength compared to some of these other knee injuries. But it's actually not as common to re-injure. So once it heals, it's unlikely to get re-injured. But being able to return back and be able to play at the same level is a different question. So even though it's not as common to re-injure, it's really hard to regain all your strength and regain that explosiveness that you need. I mean, it's not like you. I mean, you're able to regain that no problem. But these NFL players, sometimes it's a little more difficult.
You got and listen, when it comes to that, like you got a linebacker, you got Nakobe Dean. He's a linebacker who needs explosiveness, right? Change of direction. How long until you kind of get that back?
Yeah, I mean, look, everything I've heard and we've sort of seen on the, from some postings and stuff is that his recovery is going extremely well.
Yeah.
But it's really between this 6 and 9 month mark where we're going to see, how he's able to really, return back to form. And hopefully, whether or not he's really going to start at the beginning of the season or they're going to maybe wait until, somewhere between week 4 and week 6 to really let him play. And I'm sure over the course of the season, it's going to take him some time to return. The news that I'm sure you don't want to hear is that when they've looked at this from a research standpoint, it's about 50% that really return back to form with this injury in the NFL compared to some of these other injuries where we're 70, 80, 90% for getting people to return. So statistically, it has been shown that he's got a little
Wow.
less likelihood to return back to play, and it's also been shown to kind of shorten careers.
Hmm.
So it's concerning from that standpoint for sure.
Wow. I didn't know
No.
that. Especially when compared to what's the percent? I don't know if you know off the top of your head. I don't know me that, but an Achilles coming back from Achilles or coming back from an ACL. What it
Yeah,
feels like they're
they're
more
more
normal now.
like, sort of in the 70-80%
Yeah.
mark for being able to return back to play and at a successful level. But all these injuries have been shown to have some
Mm.
effect on career length. And I mean, look, when we think about this season for the Eagles and what they did last year, there's no question that staying healthy is probably the number one thing that's going to affect their ability to have the kind of success they did last year or return to a Super Bowl.
Yeah, it's fascinating. You're spot on. I love. You know what I love? We talk about this every other week when you guys come on, and especially you, Kev. Like you're a sports guy. Like the greatest thing about Rothman is the doctors are all sports people, like movement and you're not just brilliant doctors, but you're sports people. So you understand everything from diagnosis past surgery and everything about it.
Yeah, most of us go into orthopedics because we love sports, and that's where our passion is. And certainly as a sports medicine specialist, it's what I do for a living. So I love getting athletes back to play, whatever level that is. But absolutely, I'm a sports fan through and through, and I'm a Philly guy. So of course, I love our birds.
I love it. You're the best, Doc. You're the greatest, man. We love you. Have a great weekend. Let us know when you want to come in one week. All right?
Yeah,
I know
absolutely.
you're
That'd be
busy,
great.
but like you gotta get a minute. We'd love to have you.
Thanks. I appreciate that.
Thanks, brother. Have a great
All
weekend.
right, take
Dr.
care.
Kevin
You too.
Friedman. He's awesome. We've had
He's
a
got great energy.
great personality.
Yeah.
He's
I usually
terrific.
feel my blood pressure go up when I see a doctor, but not Dr. Friedman.
Yeah.
Makes me calm and relax. Yeah.